Hello everyone, welcome to Agila's Insights, a channel for lifelong learning. Thanks for liking, commenting, sharing and subscribing the channel. Today's topic is role of corticosteroids in corona cases. How steroids act in COVID cases. WHO, World Health Organization, issued new guidelines on the use of corticosteroids for the treatment of novel coronavirus infection. Following the results of data of meta-analysis from 8 randomized clinical trials, WHO has made two recommendations. Corticosteroids therapy can be used for 7 to 10 days in patients with severe to critical COVID-19. This is the first recommendation, and the second recommendation, the same cannot be used for the non-severe COVID-19 patients. Corticosteroids are low-cost anti-inflammatory drugs which mimic cortisol, the hormone naturally produced by the adrenal glands in humans. They are commonly used in the treatment of inflammatory conditions of muscle, blood vessels, eye, brain, spine, etc. The commonly used corticosteroids are dexamethasone, hydrocortisone, methylprednisolone. Clinical trials held in UK announced that dexamethasone reduced death by up to one-third hospitalized COVID-19 patients. Who react? That is WHO REACT. REACT means Rapid Evidence Appraisal for COVID-19 Therapies. These working groups published meta-analysis on the association between systemic administration of corticosteroids and mortality among critically ill COVID-19 patients. The researchers classified trials based on the low to high doses of corticosteroids. The study reported an absolute mortality risk of 32% with corticosteroids compared to assumed mortality risk of 40% with usual care. Trial results from diverse clinical and geographical settings suggest that in absence of compelling contraindications, a corticosteroid regimen should be a component of standard care for critically ill patients with COVID-19. Hence, WHO recommends systemic corticosteroids for the severe and critically ill COVID-19 patients based on a moderate certainty evidence. WHO highlights that corticosteroids are low cost, easy to administer and readily available globally than the one which is expensive, difficult to obtain and require advanced medical infrastructure. Corticosteroids are among a relatively small number of interventions for COVID-19 that have the potential to reduce inequities and improve equities in health. WHO recommends not to use corticosteroids in the treatment of non-severe patients of COVID-19 and also the patients who are hospitalized for the isolation purpose based on the low certainty evidence. Indian government revised the guidelines on the clinical management of COVID-19 patients. It recommended IV dexamethasone for the moderate to severe COVID-19 patients. From this video, we understood that systemic corticosteroid therapy, especially dexamethasone IV, can be used for severely ill COVID-19 patients. This therapy should not be used on non-severe COVID-19 patients. WHO and Indian government is updating the researches on COVID-19 and revises the guidelines for the management of COVID-19 patients. If you feel this video is useful for someone you think, share it, subscribe the channel and press bell icon to get the notifications. Take care and be safe.